Hi, my name is Jeffrey Bognot, a student at Grand Canyon University, and I'm here to present to you a strategic plan for the Long Beach healthcare system. VA Long Beach healthcare system is located in Long Beach, California, with the vision that VHA will continue to be the benchmark of excellence and value in healthcare and benefits by providing exemplary services that are both patient-centered and evidence-based. We have a mission to honor America's veterans by providing exceptional healthcare that improves their health and well-being. I will focus on patient fall for my strategy. Patient fall is defined as an unplanned descent to the floor with or without injury to the patient. Patient fall has been in the talks when it comes to patient safety, and many have researches are geared towards fall prevention. Why did I choose patient falls? Falls on patients aged 65 and above are the leading cause of injury-related death in CDC. Falls contribute to longer hospital stay, increased cost of healthcare, and poor health outcomes. Since I work in a gero-psych unit, I cater to this age group. Therefore, the population that I have are the very ones that are least that are at risk for fall. As of September this year, we have a total of 8 falls already, wherein 2 of those falls reported happened in the beginning of September, which is during the weekend. The fall prevention needs to be revised to cater our patients who are elderly and, of course, admitted in the mental health facility. And then falls can also injure staff. The goals of my strategic plan will be to reduce or eliminate the incidence of fall, preventing fall-related injuries, shortening the stay of patients, providing high-end quality healthcare. Primary stakeholders for this strategic plan will include the managers, staff nurses, staff LVNs, social workers, psychiatrists, and the environmental services. We will also coordinate with the Fall Prevention Program Committee of the hospital and then with the executive leadership. We will also designate fall champions that will consist of one member from management, one staff from night shift, and one staff from day shift, and one volunteer. The revisions for the new action plan that will be proposed for this strategic plan will be as follows. Fall assessment on admission will be done, a daily admission, and a Morse fall scale assessment upon discharge. In our current fall prevention program, we only assess patients on a day on admission and one upon discharge. We're missing that daily assessment that will give us an idea on how the patient is performing from day to day. As you know, the patient's condition as the day advances. This will give us an idea in identifying the patient that are risk for fall, whether they're low, moderate, or high risk. The leaf sign, yellow sock, and an armband will be in place to identify those patients that are at risk for fall. Patients that are high risk will be placed near the nurse station. A room will be designated for patients that are high risk that will be close to the nurse station so that they can be monitored closely. One-on-one care for high-risk fall patients will be conducted specifically with patients receiving psychotropic medication such as Ativan, Haldol, Seroquel, which can alter their behavior, which can alter their mentation, which can make them dizzy, or can have them lose their balance. We will also advocate for the use of assistive device for ambulation so that they will have support whenever they walk. We will conduct purposeful rounding, which we will be focusing on pain, body, position, and possession. We will remind the patient to call us and don't fall. We will advocate the use of call lights. If approved, fall prevention policy will be modified, and then we will communicate the device plan to everyone that is involved, including all the staff members, by conducting a meeting with the staff and continuous in service. Pamphlets, posters, and flyers will be distributed to everyone as a way of informing them of the new program that we're going to implement and the new process that will be in place. Emails and newsletters will be updated on a daily basis regarding the progress of the projects. A suggestion box will be in place so that people can pitch in their 10 cents, react to the change that's been going on, and be open for suggestions on how to implement the process more or whatever comments they may have in mind. An online survey will be also provided for us to be given feedback on our progress of the program. Fall prevention update will be discussed during staff meetings, and minutes will be updated that will be visible in the unit for those people who cannot attend. We also have daily huddles wherein we can discuss the progress, announcements, and other updates regarding the fall prevention program that we will be implementing. A monitoring tool will be created um, for the program, which includes the following information: patient information, location of fall, the time of fall, contributing factor, the injury, and the treatment. This will provide us input whether the plan is working wonders, whether the plan is making progress. If we are stagnant, this will also determine, give us an idea on if we have to eliminate a certain procedure, if we have to enhance a certain aspect of the program, or we have to revise something towards the achievement of the goals. Our reward system will be in place in order to encourage people to join in and be on board the change process that's going to happen. If there will be no fall in 1 month, we will provide the staff members with refreshments. In 3 months of no fall, the staff member will have an ice cream social, a good way to socialize with with staff members, and update them with the process that we are having at the moment. After 6 months, we will have a lunch with the staff members, giving them recognition and assuring them that their efforts are being recognized by the management. If no patient fall for 1 year, a family picnic will be conducted together with all the staff and the family, a good way for team building and strengthening the bond and the cooperation between everyone, and promoting us as a big whole family and one team. Thank you very much for listening. That is my strategic plan for Long Beach Healthcare System, and have a good day.